Hello, everyone. Just gonna give you a chance to jump in. Kumusta po ang lahat? Hello. Come on in po. We are starting our live Q&A. Medyo naantala po yung ating broadcast. We will start our live Q&A. Pasok na po ang lahat. I will pull up some questions from the last few lives, and yung mga gusto po magtanong, I encourage you to put in your questions as well regarding low carb and fasting. Yun po yung pag-uusapan natin tonight, low carb fasting. So sa community, I'm trying to find that question. Sa community natin, sa low carb fasting and holistic wellness community, merong nagtanong. Let me find that. We have a list of yung mga questions natin, but there was a particular na tanong regarding yung kanyang journey. So I'm trying to find that po. While I'm doing that, come on in and maglagay po ng katanungan kung merong itatanong. So give me a moment. Okay, so tonight po, live Q&A po tayo. Hello sa lahat na nandito. I'm just trying to find yung question po, Give me a moment lang kasi hindi ko ma-access yung tanong. Ito'y tinanong ni Miss Ina Gutierrez. I told her that I'll answer her question dito po sa live natin tonight. So I'm just looking for that particular question. Okay, so ito yung kanyang question. So una nating sasagutin yung tanong ni Miss Ina. Let's see, nandito na ba siya? Hello po kay Miss May Jill Carlos. Hello, magandang gabi po. Mr. Brian Espinida, hello po sir. Kumusta po kayo dyan? Saan man kayo naroon? Si Miss Vivian, isang active member po natin. Magandang gabi, Miss Vivian. From Puerto Princesa daw si Miss May Jill. And ang ating moderator, hello, Miss Maribel from Japan. Magandang gabi. Miss Lulu, good morning. Ang aking patient. Yes, good evening. Yeah, so, yan, merong tanong si Miss Vivian. Sasagutin natin yan in a moment, Miss Vivian. Ito yung kanyang tanong. Kapag tumikim ng niluluto while cooking, does that affect fasting kahit sobrang konti lang? So theoretically, there are two ways to look at it. Theoretically, kung talagang we go by, chemistry, effects, insulin and all that, if you are, let's say yung niluluto mo is something na yung sabaw lang yung tinikman mo, and the sabaw does not really have any sugar, wala naman siyang mga condiments. Let's say, tinitikman mo lang kung tama lang yung salt niya. So the water, salt, paminta. Theoretically, that will not affect yung fasting mo kasi wala naman siyang anything that will stimulate insulin. Now, kung sauce yan, right? Like kunyari, tomato sauce, and syempre may mga kung ano pang spices by themselves, normally they don't. Pero kung yung mismong tomatoes, right? Like tomato sauce, for example, then that can potentially do it, but it's very, very, very minimal. Kasi tikim lang naman, wala pang 1 tablespoon yun, right? Kung talagang strictly biochemistry yung pag-uusapan, maaari. But the amount is so minimal that you shouldn't even worry about it. Okay? So, yun po. And hopefully, hindi naman na kayo gumagamit ngayon ng asukal, right? Sana erythritol na yung mga approved sweeteners na yung ginagamit natin sa pagluto. So, in that case, that's even, it's even better. Hindi talaga siya Kung meron mang effect, it's very, very minimal. So, don't even worry about it. Naghahanap pa tayo ng mga tanong dito. Sabi ni Mr. Brian, ask ko lang, my 48 hours fast now, what drink should I make na di mag-break ng fast ko? First time doing 48. So, 48 hours. So, first of all po, is yung mga gumagawa ng mga extended fasts, kasi ito ipasok na sa extended fasting. It's important to know yung mga principles behind that po. There is a way to safely do it. There are certain supplements that you need to take kapag matagalan na. You have to take into account also your medication. So let's say healthy po si Sir Brian, wala naman siya mga iniinom mong gamot. He is basically, sabihin na natin, walang contraindication sa fasting. Then, the important thing is to supplement po, supplementation with electrolytes kung you will go longer. Usually, first 48 hours should not really be a problem. If you can take some, let's say, so given na lagi yan, sa mga community natin, sinasabi natin salt, right? Water, you can make a solution. So usually a liter, I will do like 1 teaspoon. So iba't ibang formula. Myself, what I do, a liter of tubig, teaspoon ng Himalayan salt. Maybe I will put, let's say, half teaspoon. Medyo matapang yung kasi yung cream of tartar, like it tastes like chlorine. So you can put quarter teaspoon to half a teaspoon if you like. And for 48-hour fast, that should be enough kasi yun na yung sodium potassium mo eh. And then you can take magnesium supplement as a standalone, parang lang yan capsule. So 48 hours, I wouldn't really worry too much about it. Ito lang ay kung nagkakaroon ka na ng mga cramps, feel dizzy. But before you even attempt to do 48 hours, you should actually have done low carb muna, kasi you cannot go into that na very intense na nag 48 hours ka na hindi ka nag low carb, dami mo mararamdamang side effects. Ngayon kung tama naman yung pagkakagawa niyo, sir, and kayo nag low carb muna talaga before you went into your 48 hours, which hopefully is the case, and hindi kayo masyado nakakaramdam ng side effects, then water electrolytes lang should be enough. And perhaps the magnesium, as I've said, definitely for much longer fasts, marami pa tayo mga supplementation na kailangan, depends on how long. So baka kailangan ng multivitamin. So let's say you're gonna go on an extended fast. Again, lagi may patnubay ng doktor. We don't encourage you doing that. Yung mga longer fast, more than 3 days na walang patnubay ng isang, certified low carb, either coach or doctor, lalo na doctor kung kayo may mga karamdaman. Kasi may mga, kakailanganin pa for longer fasts. Pero 48 hours should just be electrolytes, magnesium, that should be okay. Melvin is here, magandang gabi. Hello. Hi, si Miss Valley. Hello, from Italy. Magandang hapon po siguro, Salamat sa panonood. Mr. Rowena is also here. Hello. And si Haniko, ang ganda ng name niya, Haniko. Okay, so we'll get on with, titingnan ko po kung may mga tanong later, but yeah, sabi ni Mr. Brian, I've been doing for almost 2 years na. Okay, that's good, sir. So, you know the drill naman na, very important lang for longer fast, maybe do yun nga, yung supplementation for beyond 72 hours. And also, hinay-hinay po sa pagbe-break ng fast para maiwasan natin yung, number 1, pinaka-fatal is yung refeeding syndrome. Hindi naman yan nangyayari kung tama yung mga supplementation natin, tama yung pagbe-break ng fast, and then yung minor, yung dumping syndrome, nagkakaroon ng mga diarrhea pag mali yung paraan ng pagkaka-break ng fast. Okay. So, I will pull up yung mga questions po. Sulat niyo lang yung mga questions niyo. Yung hindi masagot, we will answer them sa mga susunod na live. So ito, galing kay Mr. Rod Bernales. Give me a moment. Can 18 hours fasting daily be continued for a lifetime? So yun po yung tanong ni Mr. Rod. So kung kaya daw ba ang 18-hour fast, araw-arawin mo? So, anything na pang matagalan needs to be sustainable. So realistically, ask yourself, kaya ba na parang life is so dynamic po, maraming mga pangyayari. Sometimes, magkakaroon tayo ng moments na, depende sa kinakain natin. May mga moments na hindi kakayanin yung 18-hour fast. May mga moments na you can have longer fasts. May mga time na kayo ay magta-travel, for example. May mga times na, may mga darating na changes sa buhay nyo that can prevent you from doing 18-hour fast realistically every day. So, 18-hour fast, it's good to vary kasi ang inyo pong schedule dahil you want to have flexibility. Tinatawag natin, later down the road, metabolic flexibility po. Nothing, it's not a good thing to, even yung OMAD po, we tell our community members, yes, it's good to, maybe do that in the beginning kapag may inaabot kang goal na, let's say, magi-intensive ka, mag-OMAD ka for most of the days of the week. But yung araw-araw kang OMAD, medyo nagiging inflexible yung metabolism mo. And so, kung may mangyari man na you're not following that, na kunyari, lagi kang OMAD, tapos magre-readjust ngayon yung metabolism mo, basal metabolic rate mo, ganon, and hindi ka flexible, then at some point, yung BMR mo, because the body, may fat thermostat yung katawan, as I've mentioned in many, many lives before. And usually, magre-reset yan kung saan talaga siya sanay. So even if mababa yung kinakain mo na pagkain, and usually nangyayari to, lalo na sa mga nagka-caloric deficit po, magre-readjust din sa inyong BMR. And you will start to notice slowly nag-creep up agad, again yung weight. And nagtataka ka, bakit ganun? OMAD ka naman lagi. And, you're eating like really low carb. Bakit ganun? Kasi nag-readjust siya. So, in order to avoid something like that, you need to make your body have what we call metabolic flexibility. And yung metabolic flexibility, maraming iba't ibang pamamaraan. It's a little bit more advanced topic. But the point is, it's good to have a variation ng schedule. Hindi lang like OMAD all the time. Perhaps on the weekend, you can have TMAD. Let's say you're gonna work out, add natin yung TMAD. Maybe that's, a good variation. Let's say you do 3 OMADs, tapos 4 na TMADs. You can do yung mga protocols, mga ganun po, or you can put in your extended fast in between, parang mga times na nag-OMAD and TMAD ka. So, there's no one way to do it. Every person is different. Every person has different needs, goals, even body types, metabolism, genetics. You have to find the best fit for you. I recommend na hindi po, laging ganun yung schedule na 18 hours every day, ganyan. Bago-baguhin natin para ma-trigger yung metabolic flexibility. Just always remember to continue yung cornerstone, which is keeping low carb. Okay, fasting kasi can be adjusted. That's a beautiful thing about fasting. It can always be adjusted according to your needs. Yung foundation, the core foundation is, ano pa rin yung kakainin mo dun sa time na hindi ka nagfa-fast. Kasi I see this a lot, kahit napakaraming tao, 18 hours ako every day. Pero they're struggling. They're struggling with their weight still. Hindi sila nakakakita ng pagbabago. Bakit? Kasi they miss out on the cornerstone, which is, yung cornerstone talaga is what you eat during your non-fasting hours. So always remember po na huwag natin kakalimutan yung foundation. Fasting can be varied. Pwede siyang bagu-baguhin. And mas maganda kung may variation kasi matitrigger yung ating metabolic flexibility. So yun po, which is, a topic for another day. So thank you for that question. Isang question pa dito, if we have maintenance, is it okay to do fasting for 2 days and don't take the maintenance med? Thank you. So sabi ni Miss Leah Pearl Del Rosario. So sa mga ganitong sitwasyon po, always consult with your doctor kasi I wouldn't know what medication you're taking. Some of the medications, let's say, can be taken without food. So kung ganun po, then you're okay to take that even when you are fasting. Kasi it doesn't really depend on food presence, but certain medications need to be adjusted. So this is a case-to-case basis. Consult with your doctor. Kung hindi maalam ang doktor, pwede rin magpakonsulta sa low carb practitioner na doctor po para magabayan. But I highly suggest yung may mga gamot dyan, lalo na po yung mga malalang diabetics na ang mga gamot nila, even include insulin. Be very careful po, kailangan niya ng adjustment. So work with your doctor regarding medication adjustments. So yung susunod pong tanong, give me a moment. Miss Victoria Abeleda, if I have not really reached my goal weight, I want to remove excess fats, hindi po ba advisable mag-workout? Will working out increase my weight? Thank you. So that's a great question. So let's say, depends ito, again, yung mga journeys natin, depende yan sa stage. Gano'n na natin ginagawa, gano'n na natin katagal ginagawa ang low carb, gano'n na natin na-incorporate yung fasting sa ating regimen, kasi that will dictate if you can actually have more room to lose weight even with just low carb and fasting. So I always say this, although nakikita po ninyo that I exercise a lot, but I always remind you that for weight loss, okay, so iba't iba po yan na purposes, specifically for weight loss, we cannot rely solely on exercise. It is a good supplement later in your journey kung kayo ay, let's say, you've maximized yung inyong low carb and fasting regimens. By maximized, I mean talagang consistent kayo sa paglo-low carb, kasi hanggat hindi po natin na-maintain ito until we don't really, get into yung totoong clean low carb, hindi natin masasabing na maximize na natin yung low carb as a weight loss strategy. So una-una, maximize muna natin siya that way. Keep below 50 grams per day if you can. So kung kaya talaga ninyo mag-keto, so less than 20, then do it. Pag hindi kaya, di 50, it will be a much slower process. And make sure that you've also done your fasting na rin. And if in spite of those strategies, let's say nag-try ka na rin mag-extended fast, tapos marami ka pang ilulose na weight, then you can think about, of course, working out to actually get your metabolism to go faster. So ang pag-workout, what's the thing about exercise? So ganito po yan. Exercise, number one, should be done no matter what. Okay? It should be done no matter what. And I'm speaking from the point of view, like my own point of view, which is yung autophagy, longevity effects, cardiovascular effects ng exercise. We know na kapag nag-exercise tayo, marami tayong na-activate na iba't ibang pathways that will help us to live longer. So ito yung autophagy concept ko. I always talk about this. Now, bakit importante din siya sa cardiovascular health? Because it optimizes the way that our cardiovascular system works. So given na po yun, Now, when it comes to weight loss, how does it work? How does exercise optimize weight loss? So let's say ang situation po ninyo, kayo ay nag-optimize na ng inyong low carb and fasting regimen. So very important po yan, nag-optimize na. Ibig sabihin, you're really doing it, you're a clean low carb, you're already fasting, nag-try ka na rin mag-extended fast ng periodic extended fasting, then you can now use exercise, working out, to build your muscles para mag-increase ang BMR. Remember guys, I've talked about this before. If you haven't watched my video doon sa YouTube regarding this diet or exercise, please watch that. Kasi doon ko na-explain yung things about basal metabolic rate, yung exercise post-oxygen consumption, why they are important, how they, help you increase yung inyong basal metabolic rate, which is what determines kung gaano karaming energy gagamitin ng katawan mo at gaano karaming burning ang gagawin ng katawan mo. If you are wanting to get rid of excess weight na hindi mo magawa from your low carb and your fasting, ibig sabihin nun, your metabolism is getting in the way. So, if your metabolism is in the way, then you have to optimize it. And one of the most effective ways to optimize metabolism is through increasing your BMR from increased muscle mass. Kapag mataas ang ating muscle mass, pagka nag-build tayo ng muscles kasi consume energy. Isa siya sa mga bagay na magpe-predict ng pagtaas ng konsumo ng enerhiya ng katawan natin. And kung marami kang muscles, mas maraming mag-burn na energy. Remember, fat, hindi nagbe-burn ng energy ang fat, right? It doesn't require it. So, patataasin mo yung muscle mass mo, ang mangyayari, tataas yung ngayon yung BMR mo. So, yung na-experience mo mga weight loss plateau, yung mga nag-weight loss plateau po dyan sa low carb and fasting. So, this is where exercise really comes in. Specifically, strength training po. Kasi we have to also talk about anong klaseng exercise yan. If you're just mainly doing cardio, let's say, running, jogging, if that's your kind of, yun yung gusto ng katawan ninyo, you have to know that that's not going to be enough. You have to put in strength training as well kasi you want to increase your BMR, okay? Which will not really happen until you build muscles. So yun po yung kasagutan dyan, medyo complicated. Yan? Again, watch that video that I did. Diet or exercise, nasa Filipino Success Movement channel po yun. And you will understand this a little bit more. But thank you for that question po. So next one, good evening. Paano po dapat gawin na maintain na po ang kilos? Ayaw ko po bumaba pa ang timbang ko. So ang kasagutan po dyan ties in with that previous question to maintain body mass, lalo na po, muscle mass, tamang timbang, especially as you get older, very important po talaga ang role ng exercise. Kasi every year po, ang ating mga muscles nagwo-waste. Nababawasan yung ating muscle mass. In replacement, magkakaroon ng fat. So I'm talking about specifically people, 40 and above. Katulad ko po, So 40 and above, mapapansin nyo po ito. Pag bata pa kayo, hindi nyo mapapansin yan masyado. But metabolism changes as you get older. It's all hormonal. Meron pong effect ang hormones dito. Merong effect yung pag-slow down ng metabolism. Merong effect yung mga longevity factors natin kung bakit nagiging taba yung ating muscle naturally. Kahit anong gawin ninyo, talagang mangyayari yun. And as we get older, remember that insulin resistance starts to creep up. Kaya nga all the more, when you get older, you have to have a complete regimen. More holistic po, hindi lang, low carb fasting. Low carb fasting, combine that with exercise to offset itong mga hindi natin maiiwasan na effect ng getting older. And then, of course, kasama dyan, lagi kong sinasabi, holistic. When I say holistic, syempre, sleep well, de-stress, very important po yan, dahil itong mga hormones na kaakibat ng pagtulog at pagiging stressed out all the time, they also impact metabolism. So, very important po. Salamat doon sa tanong na yun. Another question, is it okay to take meds that inhibits carb absorption? So, if you're taking, do you mean this in the context? If you mean this in the context na yun lang yung aasahan mo sa pagpapapayat or, pag-reverse ng medical condition mo, I don't really recommend that kasi you have to think of sustainability. Again, go back to the science. If you're not changing your lifestyle, root cause medicine po tayo. If you're not really changing the source, di ba? Imagine po ninyo, merong nagbabaha, and then merong gusto ninyong pigilan yung pagbaha na galing sa isang gripo na merong hose na nakakabit. And ang gagawin nyo para pigilan yung pagbabaha ay tatapalan nyo lang yung hose, for example. You're not really addressing the root cause. So why don't you, isara mo na lang yung gripo, right? So best thing is still to go back to the foundation. Go low carb po. Hindi mo kailangan yung medications that will inhibit carb absorption para matulungan ka in this lifestyle. All you need is capitalize on the foundation, low carb and fasting. Now, if you are taking medication, so usually for mga diabetics ito, it inhibits low carb absorption. Again, work closely with your doctor kasi sometimes you will actually need adjustment of those medications. Siyempre, kung wala ka ng masyadong carb na kinakain, why would you need a low carb, carb absorption inhibitor, right? So, yun po ang sagot doon. This one, 6 months na po low carb si hubby, 5.6 years, maintenance, high blood diabetes, tinanggal na po ni doc ang gamot sa sugar, pero high blood pa din, 130/90. Ano po ang mali sa pagkain? So, 130/90, the systolic is actually in range. 130 is normal. 90, medyo may kataasan pa, nandun lang siya sa limit. Usually for these cases, it's important to look at, are there other factors? Si Habiba ay nagsisigarilyo. If he's maintaining his weight, then I would encourage maybe kung medyo sedentary siya, add exercise. Kung kulang pa rin yun, maaaring may iba pang sanhi po yan. So there may be an issue sa kidneys na niya mismo. And so that's why try to optimize again yung kanyang, the whole picture po. So look at yung kanyang, yung ibang aspects pa ng lifestyle niya, like smoking, alcohol intake, how is he sleeping, kumusta yung kanyang, what did I mention kanina? Mga family history, for example, sa kidney diseases, kasi certain kidney disease can still give you like higher pressure kahit ginagawa mo na itong low carb fasting optimally. Kumusta yung kanyang pagtulog, yung kanyang stress levels. Again, there are many factors that affect high blood pressure, ang pressure. Kung na-optimize mo na yung pagkain, nag-lose na siya ng weight, nasa ideal weight naman na siya, look at all those other factors kasi they also affect pressure. So, basahin pa natin yung iba dito. Okay lang po bang gumamit ng sinigang mix? Yun lang po kasi available sa market dito. Since yung nasa ingredients hindi pasok sa low carb and yung oil po ba galing sa grilled chicken or pork, pwede bang i-reuse? Yeah, so as much as possible, we really encourage you all to go for whole foods. By that, gamitin natin at least amount of times as possible yung mga ready-made na. Kasi hindi talaga po natin may iwasan yan. Many times, these things have a lot of chemicals, preservatives, hindi po ba? So why don't you just, instead of sinigang mix, kayo na lang po ang magtimpla, buy some, whatever you prefer for sinigang. Kung gusto ninyo, like in my case, lemon maybe, or maybe yung kamyas, or maybe yung sampalok, you make it yourself. The closer it is to the whole food version of it, yung talagang tunay, like yung kamyas, o kaya yung lemon, o kaya yung, what was the other thing? Sampalok, then do it that way po. Kayo na po ang magtimpla. Kasi talagang we cannot. If you're only gonna do it like very infrequently, I guess that's okay. But if you want to stay really clean low carb without provoking inflammation, kasi the reason behind hindi natin nire-recommend yung mga ganun po, mga processed food, mga chemicals, ganyan, is because of the inflammatory effect din. Dahil sa mga fake, yung mga ingredients na very chemical based. So, yun po yung sagot doon. And the other part of your question, yung oil. Yeah, so remember guys, doon sa ating food guide, yung hindi pa nakakita ng food guide, again, this is available sa ating low carb fasting holistic wellness community. Nasa announcement section. Kung gusto ng PDF, mag-message lang doon and we will send it to you. Nakalagay dito yung mga iba't ibang uri po ng fat from animals you can certainly use. So lard, tallow, yun yung mga taba nung animal. So yung oil na yun, as long as hindi po, like kasi when you're grilling, make sure that you don't also burn the food. Remember yung mga glycation products, advanced glycation end products, AGEs, yun po ay nabubuo kapag masyado nating nasunog yung pagkain. So if you're gonna collect the oil from the meat that you grilled, make sure na hindi siya sunog para walang AGE at puro yung oil. So kung kukunin nyo lang yung taba ng baboy na pinaglutuan or mantika from the beef or the chicken, that's okay po. That's fine. Again, just be mindful of the way that you cook the food. Tapos yung sagot ni Miss, yung tanong ni Miss Ina, give me a moment. Sana pala yun. Give me a moment. Nawala na. Anyway, yung tanong niya is about GERD. She asked why she's feeling. So sabi niya, nag-uumad daw siya. She transitioned from doing OMAD at lunchtime. So isa po yan sa mga community members natin. Sabi niya, ang tanong niya, bakit daw nagkakaroon siya ng bloating, nagka-experience siya ng cramps, so gastric mga cramps sa tiyan po, after mag-shift siya from OMAD, so OMAD yata siya ng lunch, and then tinagalan niya, ginawa niyang dinner time yung kanyang OMAD, ang na-feel niya, after niya ginawa yun, nagkakaroon siya ng mga cramps and bloating. So, there are parang GERD, almost like gastric reflux symptoms, but it can be other things too. So, the first thing to consider always, pagdating, lalo na sa GERD, I always advise people, always have a consultation again with your doctor regarding working up for the most notorious cause ng mga GERD, mga gastric symptoms, which is still H. pylori. So, yung bacteria po. So, make sure that you are tested for that kasi kung meron kayong H. pylori, kahit po anong galing ng pag-low carb at fasting ninyo, magkakaroon talaga kayo ng issue with pain. Kasi this is a bacteria that lives in your tiyan. Sa inyo pong stomach nakatira yung bacteria na yan, nagpo-produce ng mataas na acid. And so, kung meron kayong untreated H. pylori, for example, at hindi nyo alam yan, and the only way you'll know that is by going to the laboratory. And so, this is why it's important, again, magpasuri pa rin sa doktor. So, number 1, yun po, Ikalawa, syempre, other labs need to be done. Meron bang issue dyan sa gallbladder mo, liver mo? Kasi magkakatabing area yan. Is it a pancreas issue? So again, the only way to know that would be to do labs, to have a proper exam by your doctor. So yun yung unang step po. Kapag nakakaramdam ng mga sintomas na a bit unusual for this lifestyle, and nagawa niyo naman na yung mga recommendations namin, like for example, kayo yung electrolytes na, meron na kayong tinitake na supplements, pero may mga sintomas pa rin kayong nararamdaman, and you know that you are following yung foundational strategy, then it's really time to see your doctor. Okay? Kasi there are certain things, like I'll give you an example. Recently, meron akong patient na tinulungan mag-lose ng weight, ayusin yung kanyang metabolism kasi she was already diabetic. So, I helped her to lose the weight, naging okay na siya, hindi na siya diabetic. And then she came to me kasi I told her, in spite of this, syempre meron pa rin tayong regular checks, kahit na reverse na yung diabetes, na in remission na yan, lagi pa rin tayong may every 3-month check. In spite of not taking medications and normal na nga, So, I encouraged her, sabi ko sa kanya, okay, now you're in maintenance phase. You have to see me in 3 months or see me sooner if you notice something is different. So dito po yan sa Canada, hindi po ito Pilipino, puti. So this patient was good enough na alala niya yung advice ko na, okay, although reverse na yung diabetes niya, she started feeling something different. May nararamdaman siyang kakaiba. Parang may sumasakit dito sa kanyang left quadrant, sa kaliwa. So, pumunta siya sa akin even before the 3-month checkup. And parang nakita ko na kakaiba nga yun. So I worked her up. And alam niyo po, it turned out to be something else. So she had pancreatic cancer. Now, hindi po yun related sa ating low carb and fasting. What I'm trying to tell you is may mga sintomas sometimes that don't make sense, especially kung medyo adjusted na kayo. Medyo matagal na kayong naglo-low carb fasting, tapos suddenly you feel something new, always check in with your doctor po. Kasi there's still other organic causes. Organic, meaning talagang sakit, na hindi naman related sa lifestyle. Like in this case, she has kasi family history of pancreatic cancer. So she inherited the gene. Tinamaan din siya. So, imbis na, like saying side effect lang to ng ganito, ganyan. She was good enough to listen to my advice. If you feel something different, you come and see me right away. So it turned out to be something different. Okay, so ito lang yung sinasabi ko sa mga kaso ng ganito, pasuri ulit sa inyong doktor, make sure you work up, especially ang mga GERD symptoms yan. Kasi did you know that when you go low carb and fasting, usually yung mga GERD will get better. Kasi chemically speaking, yung pag-low carb po kasi, high carb kasi affects the sphincter. Yun po yung gate. Gate, kunyari ito yung inyong tiyan, ito yung esophagus ninyo, ito yung inyong tiyan, tapos pababa. Meron siyang gate para pag kumakain tayo, hindi naman natin na-feel na nagre-reflux tayo lagi, right? And so the gate, that sphincter, does not work so well pag high carb ang ating lifestyle. kasi it affects certain hormones doon which affects the sphincter. Magbubukas yung sphincter, so mag-reflux ngayon yung acid up and down. Ngayon, pag mag-low carb kayo, mawawala yun. Kaya nga a lot of people, even in the research studies, a lot of people have noticed improvement of GERD to the point na wala ng gamot. Ano po? So it's a very effective, I mean, add that to the weight loss. Kasi syempre, when we get bigger, yung ating, naapektuhan din yung ating sphincter kasi napupush from all the fat, right? Kaya nga yung mga iba dyan, buntis, pag nagbuntis, lalong lumalala yung GERD. Again, it's from the premise of yung anatomy, right? So, dahil buntis ka, lumalaki, may baby doon, so then it pushes your gastric, yung inyong tiyan, up yung stomach, so then it affects the sphincter. Chemically speaking, yung mga high-carb diets that will stimulate certain hormones, so gastrin, CCK, yung mga what do you call it, polypeptide-wise. So yung mga hormones kasi na yan affect the sphincter. So ngayon, pag ang sphincter lacks, anong mangyayari? E di yung acid na nasa stomach natin, up and down, balik-balik, right? So then you get reflux, and then you get all these mga symptoms. So when you go low carb, mawawala yung ganun. Mag-work na mas maigi yung sphincter, and that's why low carb and fasting helps to relieve or even reverse yung GERD. So sa kaso na ito, na ikaw ay naglo-low carb na, nag-OMAD ka na, may nararamdaman kang ganyan, please see your doctor. Okay? Number 2, depende rin yan sa kinakain mo. So ngayon, nag-OMAD ka na, right? Miss Ina, you're doing OMAD. You pushed it to the evening time. It may just be na hindi good fit sa'yo yung timing na yon. The earlier that you will eat, mag-OMAD ka, and mas malayo siya from bedtime, actually mas maigi siya. So if you can push it back again, total, sanay naman na yung katawan mong OMAD, push it back again to an earlier schedule. So let's say instead na gabi na OMAD, you do it maybe 2 p.m. or closer to lunchtime, like what you did before and what actually worked for you, then even better. It's just that your body's not liking that late meal. Number 3 na consideration. So number 1, pasuri sa doktor, baka may organic cause. Number 2, yung timing may be pushed earlier. Number 3, ano ba yung kinakain mo dun sa iyong OMAD? Are you maintaining clean low carb? Kasi the influx of, let's say, once a day ka nga kumakain, pero pag tinignan mo naman yung net carb mo for that whole, yung 1 meal na yon, sobra-sobra, that's a lot of stimulation, my dear. That will stimulate your gastric tract ng sobra-sobra to the point that you will feel yung itong mga bloating, mga ganyan, cramping. So, really important to ask yourself as well, okay, ano ba ang net carb nitong kinakain ko? Ano yung mga pagkain na nilalagay ko sa plato ko? The closer it is whole food, the lower net carb content na meron siya, then the lesser amount of stimulation and possibly less side effect. Okay? Kasi minsan, OMAD nga, pero OMAD and maraming, masyado, insulin-stimulating food na nasa plate, tapos isahang buhos na kain. Hindi kakayanin. Talaga mag-react yung gastric tract. Okay, so look at all those 3 factors. So again, pasuri sa doktor. Ikalawa yung timing. Ilapit natin sa earlier part ng day. Total OMAD naman yan. Ikatlo, quality of food that you are eating. Okay? So, and then, of course, kung ano lang naman kasi yan, if it's OMAD, you may actually not need yung mga electrolyte supplementation na yan kasi you're eating everyday pa rin. Okay, but see if also the electrolytes will help. So, yun yung mga strategies po doon. Let me see. Now, let me pull up from the question. Tingnan natin. Okay. So, Ms. Rosemary Huang, ano po bang need na supplements habang TIMA just starts 2 weeks, no lunch? Okay, you don't need any supplement po kapag kayo nagtitimad. It means you're still eating 2 meals a day. Make sure that your meal combinations are nutrient-dense. Low carb siya, pero nutrient-dense po. You have the proper amount of proteins. If you haven't seen it already, I have a visual about this, yung how to create a low-carb plate. Make sure lang na tama ang protina, tama yung ating amount ng just enough of fat para po matulungan ma-absorb yung ating vitamins. Kasi proteins and fat are essential. And then yung carbs, optional yan. kung kayo nagsisimula pa lamang sa journey, mas maganda to really stay low carb. So 50 grams or below. Kung kaya mag-keto, why not? Depende din yan sa goal ninyo. TMAD by itself, you're still eating 2 meals a day. You're not in any risk of electrolyte imbalances, especially kung nutrient dense ang pagkain nyo. Usually, it will have, everything that you'll need. So no need for supplementation po. As long as you're eating nutrient dense meals, there's no need to supplement. Supplementation is mainly for longer fasts, 72 hours and above. Kailangan po ng supplements. Okay? Pero kung TMAD, no problem. Okay, sabi ni Miss Alpha Belen, I totally agree. Ang aking reflux, pansin ko, di na umaatake. Yes, and this is proven in research. Maraming ginawang studies about this. It's because of that gastrin effect ng high carb. And so, nag-improve talaga ang sphincter function natin. So, okay, another, same question. So, Ms. Rowena Valle Cruz, pag low carb po ba, kailangan din po ba ng electrolyte? So, again, as I've said, kung kayo'y kumakain ng nutrient-dense meals, you're properly hydrated, you don't really need electrolytes. OMAD, hindi pa rin po kasi kumakain pa rin kayo. You're eating once a day. So until you go into extended fasts, so 72 hours and above, then dun po tayo mag-iisip ng supplements and electrolytes. Okay. Sino pa po ang may tanong? Let me see. I'm trying to find question. Okay. Sabi ni Mr. Rofel Vivar, how soon can I have my FBS taken after starting this low carb? Say after a month, makakakita na tayo ng result. So, thank you po dito sa tanong, sir. So, it depends on what so look at it in a few different ways. Number one, depende sa inyong current medical condition. Kung kayo ay really, poorly controlled diabetic, na talagang ang inyong A1C ay, let's say, nasa mga 10 and above, or ang inyong fasting sugar from before is talagang super taas, it may take you a while. Ikalawa, it depends on what you're actually doing. Sa inyo pong low-carb fasting journey, kayo ba ay talagang sumusunod parang clean, let's say low-carb? Clean low-carb po ba kayo? Or paminsan-minsan kumakain pa tayo ng carbs? Kasi that will also dictate kung gaano kabilis yung ating, unang-una, weight loss. Ikalawa, non-scale victories. Again, every person has a different metabolism. Kung mismong sa sarili nyo po, napapansin nyo, I've already lost 10 kilos, syempre meron na po yun na effect. Okay? Usually, pag ganyan na 1 month pa lamang, let's say, start kayo, tapos 1 month pa lang kayo dyan sa journey, you've lost maybe 3 pounds, you likely will not see the effect just yet. What I personally do, I would check in with the patient, depende din kasi yan gaano kalala yung nire-reverse nila. I like to do 1.5 months to 3 months. Depends po, So, very much dependent on status ng pasyente, yung kanyang medical, yung gaano kalala. Kasi lalo na yung mga talagang super taas na diabetics, That one, gusto ko talaga silang i-follow up closely. So, I would do 1.5 months just to even see kung sumusunod sila. Kasi if I don't even notice na or they themselves will say na hindi naman sila nagko-commit, then it will take them a while. But theoretically, it should be within that time frame. So, depende na yan sa doktor, depende sa goals ninyo, depende sa napansin ninyo. Kung napansin ninyo, wala pa naman nagbabago sa inyo. Doing your lab after 1.5 months, will not yield anything. Maybe you are more for the 3-month check. But certainly, I wouldn't go beyond 3 months na walang check. So yun po yun, very flexible ito and again, depends on the stage of your journey. Okay, sabi ni Ms. Sophia, very effective po talaga ang low carb IF, 1 week lang po, normal sugar po. Yes, yeah, that's great. Yeah, so join po kayo sa lahat ng groups, para iba't ibang take. Yeah, so kung wala na pong tanong, let me see if I have another question. Silipin ko lang dito kung meron pa tayong pwedeng sagutin. And maybe I'll let me take one more question po, So please put it in there. Yung hindi masagot, next time na lang. Okay, give me a moment. Okay, follow up po sa watery stool. I did dry fast, 24 hours, then 24 hours clean fast, then nag-break ng egg drop soup with pork. Tapos after 30 minutes, yung watery stool pero konti lang, is it still okay po? So when hindi mag-work yung soup, so again, this is a 48-hour fast in total, ano po? And as I've mentioned kanina, isa sa mga common effects ng longer fasts, again, depende sa tao, isa sa mga common effects would be yung dumping syndrome, kung saan ano man kinain mo, magda-diarrhea ka agad at ilalabas mo. So it means that you can go like less stimulating, you can eat less stimulating food. So kung hindi pwede na, kasi egg drop, it has egg, it has the pork, so baka masyado pa siyang too triggering for your tummy kasi 48 hours siya nagpapahinga, tapos yun yung kakainin mo agad. Then you may need to go a little bit less stimulating. So for example, maybe try vegetable soup, vegetable broth. You can try even bone broth. You can even try things like kimchi, kombucha. So those are the things that are less stimulating that you can try to avoid. Although sabi mo nga, konti lang naman yung stool, but to avoid completely yung dumping syndrome, you can go easier on breaking your fast. Although 48 hours lang naman ito, hindi naman ito ganun katagalan, but to safely break your fast, then eat less stimulating food, lesser net carb content, maybe not so much protein just yet, kasi yung meal na binigay mong example, it has eggs and also pork. So very protein. So maybe you can go and try other things like I've mentioned, maybe kimchi, sauerkraut. Maybe you can try kombucha muna or vegetable-based soup para maiwasan itong dumping syndrome. So one final question po. Sino pa pong may tanong dito? Let's have a look. Okay. So great question, Miss Jazzy. So again, the fatty liver, gallstone, diabetes, these are all lifestyle-related medical conditions. So kung lifestyle-related siya, ang pinakagamot talaga para sa kanya ay pagbabago rin ng lifestyle. So pwede ba ito? Yes. In fact, these are the things that we actually try to reverse with our low-carb and fasting. Fatty liver nanggagaling sa sobra-sobrang storage ng taba dahil sa pagkain ng high-carb food. Gallstone naman, the issue with gallstone is this. It's very important to understand po yung nabuo na dati na gallstone na nandyan na talaga siya, it can sometimes worsen kasi lalo na pag nagta-transition tayo ng low carb and fasting and medyo nagkakaroon tayo ng higher fat proportion sa diet natin kasi we're trying to get rid of we're going low carb nga, so we're mainly eating protein and fat. So remember na ang fat kasi stimulates yung contraction ng gallbladder natin. Gallbladder contains yung bile na ginagamit ng katawan natin pang tunaw ng pang kontra ng taba. So para siyang sabon eh. It's like a soap, 'di ba po ang sabon kapag tayo may oily na na gustong tanggalin sa kamay natin, magsasabon tayo para ma-neutralize. So yun yung trabaho ni yung bile po natin. Ngayon, kung meron na tayo dyan ng mga gallstones, ang mangyayari, kapag kumain tayo ng higher fat content diet, which is common in low-carb nutrition, ang contraction ng gallbladder can stimulate yung stone. Na dati na kasi yung stone, meron ng stone dati dyan, maaari silang mag-travel up dahil nag-contract yung gallbladder and maaari silang magbara doon sa makipot na daanan. Kasi it looks like a pouch, gallbladder pouch, meron siyang makipot na stalk dito. Dito usually nangyayari yung pagbabara kasi makipot lang yun, tapos yung stone umakyat, masakit po yun. Yun yung nagiging emergency na kailangan operahan. So some people will have worsening, maybe even matrigger itong pag-inflame ng gallbladder dahil dun sa stone na maaring ma-dislodge, maaring makabara dun sa stalk. Ngayon, nangyayari ba ito all the time? Not really. Not really. And the good thing about doing low carb and fasting is mapiprevent yung formation ng future stones. Kasi kaya naman tayo nagkakaroon po ng stones, again, dahil na naman sa ating high carb lifestyle. So, medyo ang advice ko lang sa mga meron ng gallstones, be on the alert, parang have a high level of awareness. Kung nakakaramdam na kayo ng mga right upper quadrant pain, which is dito sa kanan, kung nasaan yung gallbladder, patingin agad sa doktor kasi baka na-dislodge yung stone. It's only dangerous if it becomes a full-blown inflammation. The pain itself, pain is just a symptom. Hindi naman siya, it's not what I would call na, talagang tunay na danger or what I would say na masamang sitwasyon. It's all about catching it early and perhaps going for removal ng stone na yan kung mapansin nyo nga na na-trigger siya kasi kayo ay nag-high carb, low carb and high fat na diet. May mga variation ng ating low carb lifestyle. You don't necessarily have to have like super high fat. You can just have low carb and hindi masyadong ganun kataas yung fat. Kung kayo magkikito, high fat talaga yan. So, depends on your goals, depends on what you're trying to do. Kung karamihan naman ng mga tao, even though may gallstone sila, can still safely do low carb and fasting as long as meron lang tayong awareness po in case nga lang na ma-trigger yung pagmamaga ng gallbladder dahil gumalaw yung bato. Okay? Now, diabetes, low carb and fasting, hands down, ang talagang tunay na treatment po dyan. Kung type 1 kayo, then kailangan ng patnubay ng doktor. Low carb fasting still works for type 1. But if you are a type 2 diabetic, certainly, you really have to adopt this lifestyle. There's no other way po, no? It's either magba-band-aid technique ka, tapalan mo ng gamot, or gamutin mo from the sanhi. And ito po yung sanhi niyan, it's a lifestyle-related disease. Ang kanyang gamot is lifestyle change din. So thank you for that question. And sino pa po? Let's see. Okay, let's see. One final question from Ms. Rosemary Huang. Mataas ang cholesterol ko, 220. Manonormalize ba sa low carb? Ang egg ba? Hindi nakakataas ng cholesterol? Salamat po. Okay, great question. So, cholesterol, yes, again, having high cholesterol is again a lifestyle-related disease unless meron kayong inborn error ng cholesterol metabolism which is namamana. But in the huge majority, vast majority of cases, ang high cholesterol comes from lifestyle. Bakit po ganon? Bakit yung mga nang-low carb fasting sa community natin, bakit sila kumakain pa rin ng egg? Hindi ba yan masama for cholesterol? So we have to understand metabolism. Metabolism po, yung cholesterol na minimeasure natin sa ating dugo, that cholesterol level actually reflects yung kinakain natin. Kinakain natin indirectly na yung nag-stimulate ng inside cholesterol production. So, anong ibig sabihin nun? Ang cholesterol na na-measure sa dugo natin reflects around 20 to 25% lamang ng kinain natin. A bigger part ng cholesterol na yan, so 75 to 80% of that cholesterol comes from inside the body, transformation ng mga usually carbs, matatransform siya into cholesterol. So, again, 25% lamang, 20 to 25% lamang ng cholesterol na kinain natin ang mapupunta doon sa cholesterol na level ng dugo. Yung 75 to 80% niyan, galing sa inside production ng cholesterol. Saan manggagaling ang inside production ng cholesterol? Nanggagaling ito sa pagkain ng high carb food. Carb kasi gets transformed into cholesterol inside the body. So, hindi necessarily na yung kinain mong egg ang magiging sanhi ng ano. And it's not. It actually is not, right? Yung fat yung cholesterol ng egg na yun, yung fat ng egg na yun will only contribute to 25%. And egg has so many benefits. Ano po? Napakaraming benefits. It's a very nutrient-dense na food item. To even think na wag na ako mag-egg kasi takot ako sa cholesterol ko because it doesn't work that way. The cholesterol level in your blood comes from transformation. Yung inside chemical transformation sa katawan ninyo coming from high carb na mata-transform into cholesterol. So, ang sagot po sa katanungan na yan, yung cholesterol ninyo kapag kayo ay nag-low carb, bababa po yan. Bababa ang cholesterol dahil yung pinakasanhi ng high cholesterol, which is high carb food, ay mababawasan na kasi nag-low carb na kayo. So, there are certain exceptions. Again, I'm talking about genetic. So, genetic diseases na talagang it runs in your family. There's a defective gene that creates itong high cholesterol. So, familial hypercholesterolemia, you have to work with an internist regarding that. So, makipag-ugnayan po sa inyong doctor to treat that kasi ibang uri yan. This is a genetic disease. Sa mga lifestyle-induced diseases, makakatulong ng malaki po ang paglo-low carb natin. Yung mga subset na mga patients natin na mataas pa rin yung cholesterol in spite of low carb, kailangang suriin ng doktor kung alin doon sa mga cholesterol subtypes ang totoong mataas. I always talk about this. Kung yung cholesterol na mataas ay yung tinatawag nating, kasi kahit yung cholesterol may subtype yan merong LDL na hindi mo naman dapat alalahanin, merong subtype ang LDL na yun talaga yung nagkukos ng heart disease. And pwede yun masuri sa laboratory by doing a confirmation test. May i-order pa yung doctor ninyo na isang special test para dito sa mga subtypes ng LDL. At kung yung subtype na yon, which is ApoB or LDL particle, ay hindi naman mataas, you don't need to worry about it. Okay? Kasi yung uri ng LDL mo na mataas ay hindi naman yung nagkukos ng heart disease. Okay? So there are a few technicalities around this. Kaya nga po, very important magpasuri sa low-carb practitioner na doctor. If your own medical practitioner is not very open to this, then marami po tayo sa community natin, dyan sa Philippines, marami po yan. Sila Dr. Fee, Doc Mike, si Doc Brian for pediatrics, si Doc Grace currently, I don't think she's taking new patients. I cannot take patients kasi nandito po ako sa Canada. Kung kayo nandito sa Canada, then okay. So you can contact my clinic. But marami po dyan sa atin, sa Philippines na mga doctors nagtitake ng patients. So yun lamang po, yung mga hindi na po masagot yung katanungan, catch me again live next time. Gagawin ko lang po is really do a Q&A with you. Okay, maraming salamat and I'll see you again soon, everyone. Have a great weekend. Bye for now.